Welcome to Topic 1, Introduction to the WHO Regulatory System Strengthening Programme. WHO supports the member states in reaching and sustaining effective regulatory oversight of medical products through the RSS programme. The ultimate goal of the RSS programme is to promote access to quality-assured medical products. The two primary objectives of the RSS programme to achieve this goal are building regulatory capacity in member states consistent with good regulatory practices and promoting regulatory cooperation, convergence, and transparency through networking, work-sharing, and reliance. The mandate of RSS activities is drawn from the WHO Resolution 6720, adopted in 2014. The resolution recognized the importance of a strong regulatory system for a well-functioning healthcare system and the attainment of health-related sustainable development goals and universal health coverage. Strategic priorities for WHO's 5-year plan for regulatory strengthening activities include strengthening country and region regulatory systems, improving regulatory preparedness for public health emergencies, reinforcing and expanding WHO pre-qualification and product risk assessment, and increasing the impact of WHO regulatory support activities. These strategic priorities guide the following WHO activities: benchmarking of regulatory authorities and delivery of technical assistance to address regulatory gaps, promoting regulatory convergence, harmonization, work-sharing, and reliance mechanisms, improving countries' abilities to carry out risk-based post-marketing surveillance to securing supply chains against substandard and falsified or SF products. This includes strengthening quality laboratories at the national level, updating standards for prevention, detection, and response to SF products, and strengthening national and regional pharmacovigilance systems. Please visit the link below to know more. As per the WHO Resolution 6720, WHO should continue to support member states upon their request to strengthen regulatory systems by evaluating the national regulatory systems, applying the WHO evaluation tools, generating and analyzing evidence of regulatory system performance, facilitating the formulation and implementation of institutional development plans, or IDPs, providing technical support to national regulatory authorities and governments. This is translated into the RSS 5-step capacity building model. Before analyzing this 5-step model, let's remember that one of the main objectives of regulatory systems is ensuring timely access to medical products. Timely access to medical products is influenced by several factors. While the quality, safety, and efficacy profile of a medical product is ensured through the implementation of good regulatory practices, availability and affordability are also critical in allowing patients to access the medical products they need when they need them. Rational use can also affect timely access to medical products. However, it should be noted that rational use falls beyond the scope of RSS activities. The challenge here is the need to maintain the correct balance between the quality, safety, and efficacy profile of medical products and their availability and affordability. Quality, safety, and efficacy of medical products should never be compromised for availability and price. Indeed, all these components need to be equally considered if we want to enhance access to medicines. It should also be considered that, to strengthen regulatory systems, investments are needed. Investments may in fact lead to a regulatory oversight which is independent, competent, knowledge-based, effective and efficient, flexible and transparent, ultimately leading to increased access. On the other hand, lack of investment can cause risks to the users, such as delayed access to medical products, increased circulation of substandard and falsified products, treatment failure, and antimicrobial resistance. Investments and enhanced regulatory oversight are necessary throughout the entire life cycle of a pharmaceutical product, from research and development to their use by patients or users. There is an inverse proportionality between investments in regulatory systems that lead to increased regulatory oversight and risk for the users. To sum it up, the less the investment in regulatory systems, the more at risk is the population. Conversely, the more the investment in regulatory systems, the more reduced is the risk to the population. WHO developed a 5-step capacity building model to further strengthen the regulatory systems of its member states. The first step of this model has been the development of the global benchmarking tool. The next step is to benchmark the national regulatory system and then proceed with the formulation of institutional development plans, or IDP. The fourth step is about providing technical support, training, or learning and networking. The last and fifth step is about monitoring the progress made by the regulatory system and the impact of such progress on the availability of quality-assured, safe, and effective medical products. The ultimate goal of this process is to assist a country in developing a stable, well-functioning and integrated regulatory system, which is associated to the concept of Maturity Level 3. In the context of pre-qualification program, Maturity Level 3 is the minimum maturity level specified by WHO for the regulatory system of a vaccine-producing country. Maturity Level 3 is also the eligibility criterion for a regulatory system that wishes to be assessed for being listed as WHO-listed authority. We will explore the development of GBT in the next topic.